This is a sample of the information provided as part of the flexible training resources available through hasup.com. Our training courses are designed to provide training participants with an understanding of food safety and quality system elements and also offer user-friendly assessment activities and competency checklists to complete the training cycle. Workplace health and safety. Key definitions for workplace health and safety. Chemical. A chemical is a substance used for a specified task. Chemicals are commonly associated with food safety and quality system elements such as pest control, cleaning and sanitation and maintenance within food businesses. Control of substances hazardous to health or COSHH. Control of substances hazardous to health is the term often attributed to employer responsibilities to control exposure to hazardous substances to prevent human health impacts. Personal protective equipment or PPE, primary barrier of safety equipment that can consist of gloves, coats, gowns, shoe covers, boots, respirators, face shields, safety glasses, or goggles. PPE is used to shield or isolate individuals from the chemical, physical, and biological hazards they may encounter. Psychosocial. Psychosocial is a term relating to the interrelation of social factors on individual thought and behavior. Safety Data Sheet or SDS. Safety data sheets are the internationally standardized way to document the hazardous properties of chemicals and other hazardous agents, including information on toxicity, first aid, personal protection controls, storage and handling precautions, spill and leak cleanup and disposal practices, transportation, physical data and reactivity data. Workplace health and safety. Workplace health and safety or WHS is the discipline concerned with protecting the health and safety of all stakeholders in the workplace from exposure to hazards and risks resulting from work activities. Workplace health and safety is also commonly referred to as occupational health and safety or OHS, workplace health and safety development. When considering the development, documentation and implementation of workplace health and safety within food safety and quality management systems, the following information should be considered to ensure effective outcomes. About workplace health and safety. Personnel communication and engagement. Workplace health and safety risk assessment. General types of workplace health and safety hazards. About workplace health and safety. This section is not a definitive guide to food industry workplace health and safety, rather a stimulus for the application for guidelines and regulatory requirements that are important to participants within the food sector. Workplace health and safety or WHS is the discipline concerned with protecting the health and safety of all stakeholders in the workplace from exposure to hazards and risks resulting from work activities. Rating higher on the immediate scale of importance than food safety and quality, workplace health and safety as a concept remains an important component as part of the regulatory requirements of most countries. It is important to address workplace health and safety concepts in relation to food businesses as they play a vital role in daily operational management as a priority for all management, employees, visitors and contractors. As well as addressing the regulatory requirements for workplace health and safety as a part of your food safety and quality program, it should also be considered a moral obligation to ensure that everyone is working in a safe environment. By applying the adage prevention is better than cure, it is possible to reduce occurrences of workplace injury and illness. The application of a systematic approach to workplace health and safety management can significantly reduce potential workplace health and safety hazards and move towards the elimination of risk. Once identified, workplace health and safety hazards must be controlled to ensure they don't manifest as human impacts. If suitable control measures are not possible, then the related hazards must be mitigated through other measures. It is important to consider that personal protective equipment is at the bottom of the workplace health and safety hierarchical ladder and should not be considered the primary control measure for workplace health and safety hazards. Personnel communication and engagement. It is widely recognized that the best workplace health and safety results are achieved when there is cooperation between all stakeholders regarding training and recognition of workplace health and safety protocols. Workplace health and safety legislation generally places extra emphasis on the employer to deliver better health and safety standards within the workplace. It is impossible to make significant improvements to workplace health and safety standards, though, without involving the workforce. Some organizations use direct consultation with their employees in conjunction with industry professionals to produce favorable outcomes. Workplace health and safety representatives should participate within levels of the health and safety structure and related professional development and training activities. This experience and knowledge can become a catalyst to significantly improving workplace health, safety, and welfare. Personnel communication and engagement protocols should also extend to visitors and contractors to any food business site. Workplace health and safety risk assessment. Workplace health and safety risk assessment is the identification of hazards against and estimation of the risks involved. If a hazard is properly identified and the likelihood of it causing harm to a person is fully assessed, then suitable control measures can be implemented to reduce the risk of harm occurring. Workplace health and safety specialists use their knowledge of assessing risks to ensure workers are subject to safer and healthier working environments. Risk assessments can be simplified by using the 5-step system. Step 1. Identify and list the hazards. Hazard equals the thing likely to cause harm. Step 2. Decide who might be harmed and how. Risk equals the likelihood of it happening. Step 3. Evaluate the risks and decide whether existing protective measures are adequate or if more needs to be done. This is the risk assessment. Step 4. Document the outcomes of the risk assessment. Step 5. Ensure the assessment is reviewed at regular intervals and updated if there are changes to working practices, always considering the capabilities of relevant persons. There are many ways of conducting a workplace health and safety risk assessment, and there is no perfect way that fits all eventualities, but whatever method is used, it must be suitable and sufficient. More detailed assessment systems may be used where there are greater levels of risk. It is important to consider that workplace health and safety risk assessment is not an exact science, and you can only get out of it what you put in. Scenarios considered within a risk assessment will determine the outcomes. There are major differences between risk assessments based on quantitative, fact-based and statistical information and those based on qualitative, subjective and personal judgment, scenarios and information. General types of workplace health and safety hazards. Workplace health and safety hazards within the food sector may be categorized as physical hazards, biological hazards, chemical hazards, psychosocial hazards. Physical workplace health and safety hazards. Physical workplace health and safety hazards may include direct and indirect risk. Direct physical hazards may include scenarios such as where a person is directly physically injured by a piece of equipment or through a tripping injury. Indirect physical hazards may include scenarios such as where a person suffers hearing loss due to prolonged exposure to high levels of industrial noise. In many food sector industries, there will always be hazards with working temperatures. From one extreme to the other, the heat of working at an oven to the cold of a freezer, temperature is a serious workplace health and safety issue. Too much heat, humans run the risk of serious fatigue, heat stroke and even death. Similarly, too much exposure to cold can cause frostbite, hypothermia and possible death. Extremes of temperature can cause extremes of consequence. It is the responsibility of senior management to ensure that all reasonable measures are taken to ensure that a comfortable working temperature is maintained. A large volume of workplace injuries are directly attributable to manual handling, including injuries caused by excessive or inappropriate lifting, carrying, pulling, pushing or holding of loads. Manual handling-induced injuries commonly impact the back, but can also cause severe injury to limbs, muscles, tendons and the heart. Because associated injuries tend to take longer to heal, they potentially have a more profound effect on the longer-term health of the injured person. Manual handling injuries are not always a failure of a weak person, but a failure of the implemented control measures. Many workplace injuries are also attributable to slips, trips and falls, which could be greatly reduced through the application of better housekeeping, improved storage and improved safety footwear. Biological workplace health and safety hazards. Biohazards such as infectious microorganisms, Viruses and related toxins can have significant impacts upon human health. The primary controls for biological workplace health and safety hazards rely on the maintenance of good hygiene practices with support from structured training and communication programs for all stakeholders. The most important factor for food businesses is to consider the scope of biological workplace health and safety hazards above and beyond those directly relevant to their products or processes for food safety and quality compliance. For example, an outbreak of a non-foodborne virus among workers may have a significant impact upon the business's ability to operate, though this may not have any immediate food safety risk. Chemical workplace health and safety hazards. As with many different industry sectors, it is commonplace for workers within the food sector to encounter chemicals and potentially toxic substances on a regular basis. These chemicals and substances can be detrimental to human health if they are not handled with care. Control of substances hazardous to health. Regulations in most countries place specific responsibilities onto senior management to assess the possible risks to health that may occur due to exposure to substances or materials before they are used through recognized risk assessment methodologies. Ensure validated and verified control measures are implemented to avoid harmful exposure. Monitor and complete scheduled health surveillance activities. Did you know that HACCP.com includes resources that allow you to create, manage and implement GFSI and HACCP-based food safety and quality programs? Improve your food safety and quality skills and knowledge? Train and develop your team to create better food safety and quality outcomes? Find suppliers and service providers to partner with your business? The information and training resources available through HACCP.com include a variety of formats, such as website content, MP4, MP4 and text, MP3, PDF and slideshow. Are you ready to take the next step in your food compliance journey? Visit HACCP.com today to create your profile and access the full versions of our food safety and quality information packages and much more.